Tonight on Let's Talk About Health, we dive into the world of pregnancy and we find out what you should or shouldn't do while being pregnant and also whether a C-section or a natural birth is better.
Plus, the story of a woman who lost one of her fallopian tubes while pregnant. Find out what happened on Let's Talk About Health.
Good evening, everybody, and welcome to another season of Let's Talk About Health. Tonight, we're going to be talking about pregnancy. And Kat, you've been married now for a few months.
Yeah,
Have
about
you thought
3.
about it? Yeah.
I'd be lying if I said no, but I do have some questions about pregnancy. You know, I haven't had a baby before, so it's scary. Which is great because we've got a gynae joining us on the show today. Please welcome Dr. Darshni.
Nice. And let's also bring out our guests tonight. Very excited about this. Sheila
Hello.
Sim and Joshua Tan.
Hi.
Hello, guys. Welcome to the show.
Good evening.
Grab a seat, grab a seat.
Darshni.
Yeah.
Thank you.
Hi.
Hi.
Air hugs.
Air hugs.
Thank you again.
Air hugs. Fist bumps.
Well, okay.
Very polite.
Yeah.
Very polite
Very polite.
Seriously. Seriously. Okay.
Well, before we get into the technicalities of getting pregnant, if anyone out there was thinking about getting pregnant, what would be the one piece of advice that you would give them?
In all honesty.
In all honesty.
It's a lifelong commitment.
Yeah, man.
It's lifelong. And
Wait.
yeah.
I thought it stops at 18.
No, dude, no.
You
How many
wish.
18-year-olds do you know who are not staying with their parents in Singapore?
Yeah, that's true. We're going to have to move.
35, 40, 45.
Yeah.
Oh my God.
Yeah, if you're a Singaporean mama, it's like a lifelong
It's lifelong,
commitment,
yeah.
and you're not going to let go. You know that. I think the first question is, are you ready for the lifelong commitment?
I want to ask though, like, how about the dads? How are the dads' lifelong commitment? Like, obviously it's going to be so different from the moms, but like, how do we better accompany our partners on this journey?
Oh, you're just scoring points right now.
Yeah,
Is your wife watching?
Is she watching?
She is.
He will make sure she
What
is.
can we do to help?
Please, use me.
From what I see in my practice, the husbands are always helping the moms. It's wonderful to see them like share the role in terms of caregiving, supporting the new mom and things like that. So it's very important.
What was parenthood like for you, Sheila?
It is a very rewarding journey, and it has its good days and bad days. In the totality, I would say I really, really love being a mom.
Honestly, I think what you guys do are amazing, and please get pregnant.
Is that your message? Please get pregnant.
You know what? The Singapore government is loving you right now.
Yes,
You know, just,
exactly.
promoting the
Vote for Joshua Tan.
propagation. Hey guys, okay, game time, guys. You ready to play a game? Pass
Yes.
these down, please. Pass these down.
it down.
Pass these
Thank
down.
you.
So if
Pass these
we
down.
lose, do
So-
we get pregnant? Or?
You know what? You will be pregnant, Joshua. So what we're going to do here is
that's a big
play
one.
fact or myth, and Dr. Darsh is going to help us out with the answers. So eating peanuts as a pregnant mother, don't want to do it because you can end up causing allergies in your child.
Fact
we'll go
or
with that.
myth?
Fact or myth?
I've not heard of this before.
Yeah, I think it's a myth.
I honestly haven't heard of this
absolutely
before.
right.
Okay.
Myth?
Right, myth, right?
Yeah. So
You
the
actually
only
eat more
time...
peanuts because there's a lot of healthy fats in there.
Correct. If you're not allergic to peanuts or dairy, it's fine. It's very good.
Okay.
Lots of good oils inside it, lots of good calcium and vitamin D.
Is it true that if you do eat these things, could it actually help from a person to not pick up an allergy?
There's no actual clear evidence, but they do say if you expose the mother to as much protein and nuts and vegetables, if the mother eats a variety of fruits and variety of nuts and meats and everything, the baby tends to be less picky and tend to eat better
Right.
compared to mums who are just like taking only particulars.
I've got a question.
Yeah.
Does it extend to seafood?
The thing about seafood is this. There's this issue about mercury. We try to avoid mercury-laden fish, so no excessive tuna, swordfish, and things like that. But you can take any kind of fish at least 2 or 3 times a week without any problems.
I've got another question.
Okay.
Food cravings when
Yes.
you're pregnant. Now, that's very common, right? Is it true that food cravings come about when your body is lacking nutrients that
You're
that's why
getting
it's
the
craving?
cravings. I would say that is a fact.
But wait. Let me just try it.
Well, don't follow us.
You may be right.
You're cheating.
I feel like people crave, like, random things, the most random things. So
It's a fact.
oh, it is a fact.
It's a fact.
Hang on. So,
Now you're gonna get pregnant.
question now. So if a woman who is pregnant craves like chips,
Yeah.
is that because their body lacks?
See, that's what I'm saying. Like chips is
sodium.
Sodium.
It's true.
Yeah, having said that, there's this very interesting condition called pica. So pica is where the patient is very... Pikachu! The patient starts craving eating soil.
Yeah.
Stone.
Like
Yes.
metal,
Yeah.
iron,
Metal,
stuff.
yeah,
like the
I've heard of that.
weirdest
Like
Like the
things.
table?
Yeah.
Like, you
Yeah,
know,
the
gnawing on the
weirdest
tables and
stuff.
all that. Yeah, that's very interesting because it's not because she's craving the table or the soil, but that's because she's lacking in iron.
Oh,
So what am I lacking when I want to eat my little baby because he's so cute?
Because it's so cute. That one's fine. That one's fine.
I think you might
you're
go
not
to
lacking
prison for
anything.
that.
Okay, one more
final-
final question.
Final question here. Sexual intercourse
Yes.
is bad for the womb or the baby inside. Fact or fiction?
I think it's a myth.
That's right. It's a myth. It's a myth.
no matter the condition of the pregnancy.
So that's a good one. So if it's a healthy, well-growing pregnancy, it should be completely fine, especially after 12 weeks gestation.
Okay.
And in fact, we encourage it closer to the due date because that actually helps in terms of going into labor.
Oh,
Yeah.
usually very scary for the husband.
Yeah.
Wouldn't the mothers not be scared? Like, why is it only the husbands who are being scared?
The mothers are usually not
Like,
scared.
oh, you sure? Like,
No, by that time, they're not scared of anything.
oh.
Yes.
Yeah.
All right, guys, we're having a lot of fun here. My goodness, I hope you are too at home. Do stay with us because when we come back from this short break, we have a story about a young mother who lost her fallopian tubes during pregnancy. We're going to see you in a bit. Welcome back to Let's Talk About Health. Now, the story of a young mother and how she lost a fallopian tube due to complications during pregnancy. Let's have a look.
My first pregnancy was in the year 2018. When I was due for my delivery, I had to go for a C-sec because my platelets was coming down and I had to go for a platelet transfusion before I delivered my girl. So yeah, after that it has been really good and lucky to have a healthy baby now. For my daughter, we plan to have a second baby. So at least she can have somebody as a friend, as a sibling to share things with.
Siblings plays a very important role in terms of they with their family. As a kid, they learn a lot when they grow together.
In the year 2022, I conceived the second time. Somehow in my second pregnancy, I always felt there's a lot of cramp in my stomach. One night, my tummy pain, my cramp was very terrible. Morning, first thing I did was I wrote an email to Dr. Dash. She sent me for a thorough checkup scan, and then I was confirmed that it's an ectopic pregnancy. She told it's a life-threatening situation, and you need to go for an immediate operation. I just started to cry because there was nobody with me except for my husband, and we both didn't know what to do, and nobody knew what exactly ectopic pregnancy is. It's just I know that I'm losing my baby.
We quickly got her into the hospital to get an ultrasound done, and unfortunately it showed that the pregnancy was not growing in the uterus but inside the tube instead. This is what we called an ectopic pregnancy. The thing that happened for Ritu is that because it had already started to rupture, this tube was no longer viable. The whole tube had to be removed because it was no longer functioning, and she was able to recover and go home in a couple of days' time. This is not considered a miscarriage because a miscarriage is a pregnancy that's located in the uterus, and due to unfortunate reasons, the heartbeat stops and then the mother loses the pregnancy through the uterus. So if it's located in an unusual location outside the uterus, then we consider an ectopic pregnancy. There is no number in terms of cutting the fertility in half because of a loss of one tube. So we always tell patients it's slightly reduced, but it's still possible.
Or because I only am left with one tube, things doesn't work out, then you guys might, try going for IVF. After 1 year of trying, I would like to finally say that I'm 5 months pregnant now. We tried for a year and finally I managed to conceive naturally. So I really urge all the females out there, if during their pregnancy, any point they feel there's some discomfort or they're not feeling good, just get it checked.
Aww,
Certainly makes sense.
What a
Good
wonderful
ending.
story.
Good ending.
Yeah.
So aside from the ectopic pregnancy, what other complications might expecting parents look out for?
There are other kind of complications that can happen in pregnancy where even when things are going well, sometimes your blood pressure can go really high. So you get this thing called preeclampsia. The thing about preeclampsia is that there are some patients who are at higher risk if they're older, or if they've had a history of high blood pressure, or if they're carrying like multiple pregnancies, that means like twins or triplets and all that, or have a higher BMI. But a lot of patients that I've seen, they didn't have any risk at all. They just happened to have a higher blood pressure when we monitored them every time they came to. And then that's when we suspected that they're having preeclampsia.
I've got a question, if you don't mind. Is there like a certain period where, for example, the second trimester, and then you know for sure you won't have these conditions, or can they pop up even at the final trimester?
Yeah, that's the scary part. A lot of these things can happen at any time. Like, for example, the ectopic, that was in the first trimester, actually the first 6 weeks. Eclampsia and obstetric cholestasis, they can happen anytime after 20 weeks.
Is there anything you can do to...
Yeah, that's where the frequent monitoring comes in. They can't prevent it.
You can't prevent
It's
it.
just
You
regular
can't.
checkups
Blood
and making
pressure.
sure that you're on the right track.
Okay, so let's talk about the pros of getting pregnant.
I think we need that.
Yeah, I think we need it, right?
We need to bring it back to center.
The pros of getting pregnant. What are some of the immediate pros?
While you're pregnant, everybody gives up the seat to you.
That's a great
Not
pro.
all the time.
I don't know about that. I've been on some trains. Have you heard any stories of mothers who used to be smokers, get pregnant, and then have quit for good?
All the time, for sure.
It's a good motivation.
Yes.
There's another thing that I heard. Getting pregnant and giving birth reduces the risk of you getting some cancers, yeah.
Absolutely right. When you are pregnant, you are surrounded by a very healthier version of estrogen. So when you're pregnant, you're surrounded by the E3 estrogen, which is a very supportive, protective estrogen. And so your chances of getting cancers and all that in the future is actually reduced when you're pregnant.
Is there an element of improved health, just in general?
When you just delivered, you have lost a lot of blood, a lot of protein, so you're actually very depleted in the postnatal period. And that's the point where you need to eat very well, a lot of vitamins, iron, calcium, and all that to kind of like replace everything back again. This is where I'm going to plug for breastfeeding. Breastfeeding really helps to lose weight.
It really does.
It really, we would say, we always encourage at least 6 months.
Yeah.
And then if you can push to 1 year, that's amazing.
I want to make a
Yeah.
confession. So this is quite embarrassing on national TV.
Oh no, here we go.
My mom told me that I would hanker for her milk until I was like 3 or 4 years old. And look at me, I grew up pretty okay.
You're 60 years old and you
Yeah.
look wonderful.
Come on, so yeah.
It's the milk. It's
Drink
mother's
mama's milk when you can.
Is it?
Let a mother do what a mother wants to do.
Oh, wait, is it okay?
If the mother wants to do it, it's okay, it's fine.
Sheila, would you like to share with us about your birth story?
Sure. I gave birth through C-sect for the first one and second one. Unfortunately, because I didn't have a choice, I had so much fibroids and cysts and polyp in my womb that I couldn't conceive.
Right.
So when I removed it, my doctor, it was a keyhole surgery, and so then my gynae was telling me that I would not be able to conceive naturally after that operation. So then 2 of my births were C-sect births. And knowing that I couldn't deliver naturally, I actually felt really, really sad. I had to grieve about it because I always wanted to deliver naturally with no epidural, and what I imagined was completely different.
Is there any benefit to either one as far as the child, like how the child's going to turn out?
In all honesty, they're the same. I wouldn't ever say that, you know, if a C-section baby would have less like immunity and things like that compared to a vaginal birth at all. There used to be this saying that, you know, when you have a vaginal birth, the baby's
through the
exposed.
canal, right?
Correct.
Yeah,
You're
that's what I
exposed to the
thought.
canal and you get all the bacteria from around the mama, and that kind of improves your probiotics and your immunity and all that.
But you get that from the breastfeeding.
You get it from the breastfeeding.
Yeah.
So as long as the mama immediately takes the baby and does a skin to skin within the
Right.
first half an hour of delivery, and then you breastfeed the baby, the baby still gets all the bacteria, all the probiotics, and all the immunity as well. So you have nothing to worry about.
Once you have your first child, is there a set amount of time that's, you know, that you have to wait before you have your second? Or is it like good to go? Next one, let's do it.
So for C-section, you have to wait till the baby's first birthday.
First birthday.
The first birthday.
To start trying.
To start trying.
Oh.
To start trying.
How about recreational?
Recreationally,
Just make
Joshua,
sure you
it's
don't
fine.
get pregnant.
Recreationally, give the mum 6 weeks at
That's
least.
all he can think about.
Yeah.
Lots of family bonding, right?
Yeah, it's important to stay together and united.
Yeah, so give the mama 6 weeks and then you're good to go. But after the first birthday, it's good to go because the uterus is nice and healed and it's perfect. But if you had a vaginal birth, you can try as early as like 3 to 6 months, it's fine. But
How many C-sects before it
Yeah.
starts getting dangerous?
you can have up to 4 C-sections after which it gets quite dangerous. By the third one, your obstetrician's already like tearing up, like, oh my God, please don't. But then they do want to have the fourth. By the fourth one, we're done. The difficulty is because every time you cut into the uterus, it gets thinner and thinner and thinner. And then what happens is that you're putting yourself at risk for the uterus to rupture while you're pregnant.
My God.
Oh, okay. That's another
there's
complication
a lot
of pregnancy.
Yeah. Even with a lot of time in between.
Even with a lot of time, because it's not going to thicken by itself.
Right.
It's like, that's what it is, that's what's going to stay. If you're planning for like more than 4 kids, try as much as possible for vaginal birth. But if you can't, it's fine. It's
But
just a medical reason.
what if after, say, 3 C-sections,
Yeah.
you decide to try and go naturally? Is that-
VBAC?
Yeah.
You
So
can
hard.
try
Oh.
after one, though. If you had 1 C-section and you want a VBAC, a vaginal birth after C-section, you can try, no problem.
Why not after 3?
So after 2 or 3, again, the lining is so thin.
Right.
So the uterus is like a balloon, but if it's a very thick balloon, it's fine. You know, when you're contracting, it squeezes and the baby can come out. But imagine if it's a very thin balloon and then you
just gonna-
squeeze, the baby literally will spill into your guts.
Oh, okay. Well, on that note, guys, we are going to head over to the demo section, but not for that. We're going to talk about postnatal care. Join us, guys. Let's go. We hear a lot about what you should or shouldn't eat during pregnancy, but what about after?
So after is where the fun starts. You get to eat really good food.
I love confinement food.
Yeah. What was your favorite?
Everything.
I enjoyed it too.
The pig's trotter. I love the pig's trotter with vinegar. I
Yes.
love the sesame chicken.
Is confinement food like a Chinese thing, or it's like multiracial? Every race has their own confinement food.
Good question.
I think in Singapore, most of the time when we talk about confinement, it's Chinese confinement. I've seen all the races of my patients doing Chinese confinement. They love it. They love the kind of food that we see right here on
You
the
said
table.
you've even seen Westerners.
All the time. They feel very looked after, and there's a nanny there to look after the baby and help them with the food. Actually, the Indians and the Malays, they also have their own confinement food as well. I know that among the Indians, they've got this thing like shark curry and things like that.
Wow.
Shark curry.
Wow.
You notice at the end of the day, a lot of similarities. Mostly fish, mostly warm stuff, mostly things with ginger and herbal stuff.
Turmeric
And things like that. It's all about nourishing the mama, keeping her happy so that she can breastfeed the child and let her recover from childbirth. Whether it's C-section or vaginal birth, they still need to recover. So the whole confinement thing is about keeping the mother safe, looking after her and making her happy.
What do we have in front of us? So that's sesame seed. Is that sesame oil?
I love sesame
I think
oil.
everything in confinement food is cooked with sesame oil.
Yeah.
I find like
Pretty
the
much.
chicken, the fish, everything has
Is that to
sesame
get
I
the
could do
fat?
that.
Is that to get fat?
Yes.
And it's warm for the body as well.
Oh, okay.
That's right.
Okay, we have a green papaya here as well.
This is very interesting. So it has to be green or orange green, but it can't be the fully ripened one.
Yeah, why?
Yeah. And then they kind of cut it and boil it with fish.
Yes, this
with it.
really works. Like after that one bowl of this soup,
Yeah.
the milk really comes.
I can
Really?
medically
Yeah.
attest to it that it works.
Okay, wow.
Yeah. So what
That's really
happens
cool.
is there is this hormone called oxytocin that we talked about earlier.
The love hormone.
The love hormone, which also helps to contract the uterus, so you get your figure back, but it also helps the breast milk to come out.
Wow.
So what happens is somehow eating the papaya, green papaya, helps to induce that. So you
Okay.
get actually more production of the oxytocin, and then the patient ends up having more breast milk.
Amazing.
There is this special fish, I don't know whether you heard of it.
Threadfin.
Yes, threadfin and snakehead fish. You take that, you boil it with this. I don't know how it works, but it really
works.
makes you...
Really
That sounds like
activates the
a
liver.
river fish.
My mom's birthday is coming up. So take this and bring it home, if you don't mind.
PTSD, stop bringing it up for her, okay? Enough of trauma for your mother.
Moving on.
Okay, we've
what do we
got
have
some
for you?
red dates.
Basically, red dates is very sweet, it's delicious, and a lot of times in confinement they say take this instead of water, which is fine because there's still a good water content in it.
Replace this and you don't drink water throughout.
Correct. That's
Really?
Yeah, that's what some of the nannies say as well.
Oh, wow.
Which I mean, like, I'm fine with it, but then most patients will sneakily go and have their own warm water anyway.
It's
Oh,
not
I
too much
love my
sugar?
warm water though.
Too much sugar.
Yeah.
Too much sugar. But it's a natural kind of version of it.
But if that's the only thing you're having,
Yeah, you're like-
might be too much, right?
And the breast milk will taste sweet.
Are you gonna
This
drink
is
it?
it. This is 4 years ago. When I was 4 years old, this is what I drank. It's not milk. This is when I was 4 years old, this is what I drank. This is why I was hooked.
The ginger. You know, I don't eat ginger. I don't like it.
What? Really?
What?
It's in
Ginger.
everything.
No. You know how sometimes you eat and then it accidentally goes in your mouth, and I'll just like.
I'm the guy eating the ginger off the fish plates. I eat it. I love it.
So confinement food, everything is ginger.
Everything. You need to dispel the wind from your body.
It gives you a lot of heat. It keeps you warm. And that's really good for recovery and breastfeeding as well.
Maybe when you're pregnant and then after giving birth, the hormones change.
Maybe,
Yeah,
right?
you know,
Because they
things-
say you
magic
will.
happens.
Okay, let's keep our fingers crossed for me. And then this, we have the
Ginger chicken soup. No,
Ginseng soup.
ginseng
yeah.
chicken soup.
ginseng chicken soup.
Yes,
Yeah.
it's so good.
And it smells amazing.
I'm actually very proud of you, Mike, that you said that looks so good.
It looks great. I love like the blackened herbal chicken soup that has all the ginseng in it. I'm huge on that. And that's what this looks like, right?
Yes.
Mike, I gotta say that you're more Chinese than I am. I cannot deal with that.
Right.
Like, ugh.
Really?
I'm very like my American friend, ladies and gentlemen. Round of
you gonna
applause.
help your
Okay, but
wife?
why is it good? Why is it good?
For pregnant? For
I
post-pregnancy?
shouldn't be asking you.
but
No,
yeah.
why is this good? It's just delicious. Please tell me.
No, like why do you think it tastes good? I think it's because it's got protein in it. So the protein inside is very important for mums who've just had a delivery. They've lost a lot of protein during their childbirth. They need to like replace all the protein in them. And it's got lots of other vitamins inside there as well.
But
yeah.
chicken is not good, right?
Somehow black chicken is the odd one out.
Yeah,
right?
for some strange reason.
For some strange
Are you taking
reason.
notes?
Chicken is not good?
This one's a myth.
Myth.
But
Okay.
I followed it like
Okay.
when I was
Okay.
doing
Yeah, me
confinement because they believe that you have more allergies when you have something that's chicken or has an
Because
egg
of the
content in it.
hormones that are pumped in, or?
And all the antibiotics and all that
Yeah,
get pumped into
yeah,
all these
okay,
things
fair
and all
enough,
that.
fair
So I didn't see any harm in it. And then they find that sometimes your wound doesn't heal very well.
Yeah, so especially for C-sec, right?
For C-sec,
Yeah.
for C-sec. So
Okay.
most women would avoid it, but they take lots of other fish and pork and all the other
Okay,
things.
okay.
And
Yeah, I noticed
somehow
we were having
black chicken
chicken.
escaped it.
Yeah.
Very
Yeah.
interesting.
Okay, that's good to know. And is there any last bit of postnatal advice that you can give to all our viewers?
I think postnatally, one of the main thing is that it's all, again, a lot about the mother. The mother needs to be the center of attention, not the baby, because the baby's out and she is going to give all she can to look after the child. So it's very important that the confinement period is all about making sure she heals, she's able to support her child, and she's got everything she needs to have a successful breastfeeding and recovery as well. And once a happy mother, then you have a happy baby.
Yes.
Today has been wonderful, Dr. Dash. We've
Yeah,
learned
thank you so much. Even
So-
after 2 pregnancies, I'm still learning a lot.
100%. So thank you for being a part of this discussion. And of course, on that note, thank you, Sheila and Joshua, for joining
Thank
us.
you so much.
Thank you.
In
too
this
much fun.
episode. That was so
Yeah.
much fun.
Too much fun.
So
and
much fun.
Hope you guys got as much as we did out of that. And maybe some of you are on your way right now to making babies. And if you are, congratulations. And we'll see you next time on
Let's talk about health.
If you enjoyed this episode, then make sure to check out our online series called We Need to Talk About This on MeWatch. Oh, this one, I don't like this
Right.
one. And then you almost sometimes want to make it hurt more.
You shouldn't do that. This is an early stage oral cancer. It could actually slowly progress into advanced stage cancer on the tongue.